Welcome to the Sterling Voice Coaching video blog for the month of June 2015. I am your host and vocal coach, Ms. Lindia, founder and director of Sterling Voice Coaching located in Glendale, California. Singers, this month's video blog focuses on vocal health. In light of the recent discoveries of Sam Smith's vocal cord issues, Adele, and John Mayer, I thought this was an important subject to cover, especially since in my vocal studio, I see countless singers coming in with vocal cord issues. Unfortunately, by the time they seek out my services, it's too late. I need to send them to someone like our guest today. Dr. Reena Gupta is the director of the Voice and Laryngology Center at Osborne Head and Neck Institute, based out of Cedars-Sinai Medical Towers in Los Angeles, California. Dr. Gupta has devoted her practice to the care of patients with voice and swallowing problems. She is board certified in otolaryngology and laryngology and a fellowship trained in laryngology. So she has a lot to offer in this particular subject. She has a special interest in the care of the professional voice. So please join me in welcoming Dr. Reena Gupta. Welcome, Dr. Gupta.
Thank you.
Thank you for joining us today for this very, very important subject.
It's my pleasure. It's something I'm really passionate about, so I'm really honored to be here.
Well, I'm going to begin with just a basic question that I think all our viewers will be interested in knowing. What exactly is an otolaryngologist?
I get this question a lot, and I'm glad I have an opportunity to answer it. Otolaryngologist is the same as ENT, which is ear, nose, and throat. Essentially, it means that after medical school, you've decided to learn about treating ear, nose, and throat problems. Laryngology, which is what I do, is just a little bit more specialized. It's 1 extra year of training just in the larynx, or for my purposes, the voice. So that's the broad overview of what a laryngologist is.
And tell us, other than singers, what other professions seek you out for your services?
I like to think that I take care of all professional voice users, so voiceover actors, actors in general, teachers, physicians, vocal coaches, anybody who needs their voice to work in order for them to work, that's a patient that I would see.
Now, this next question for me is very critical. I want to know, what are the most common vocal problems you see among singers in your medical offices?
This is a controversial question because of my area of expertise, all I get are voice problems. And so when you have somebody who practices a very broad spectrum of ENT, they're going to get a very different distribution of voice problems. But I'm going to get somebody who comes to my office with really simple 1 day of hoarseness. So if you take all comers, my personal bias, my belief is that the most common vocal injury is incorrect use, incorrect technique. And so the symptom that comes from that is vocal fatigue, vocal pain, difficulty reaching their range. To me, that's an injury. The same way that if a football player all of a sudden can't throw quite as far, or a runner, their time is being shaved off a little bit, they don't have a tendon rupture, they don't have arthritis in their shoulder, but their instrument, their tool is not working right. That's an injury, because then what happens is the singer will push themselves to reach what they can't reach, and then you get real injuries like nodules and polyps and cysts, and all of those I find they distribute pretty equally. There's a pretty even range of all the different vocal injuries.
You know, I'm glad that you referenced sports, because I often say to many of my vocal artists that come into my vocal studio, you're an athlete. Mm-hmm. And you have to train like an athlete. You just can't go out there and wing it.
Right.
And many times athletes understand that moreover than singers.
Absolutely.
And that is something that I often, reference, is the relationship between athletics and singing, and especially in maintaining the health of the instrument.
Absolutely.
And for longevity purposes. So I'm so glad that you referenced that. That's very important.
I always find it surprising when a singer does not have a coach, because you would never accept a pitcher without a pitching coach. You would never think that was normal, but somehow the singers don't have the same sense of self-preservation to really say, this is my craft, this is what I do, I need someone to help me optimize and train. It's just not as accepted for some reason yet.
And why do you think singers resist coaches?
That's probably a loaded question as well. We seem to be doing that. I think on one hand, there's a lot of vocal coaches who don't really know what they're doing.
Exactly.
And so you do run into the problem where a vocal coach can actually lead a vocalist towards injury.
Exactly.
And that's probably the most frightening reason. I think, unlike a lot of other skills, singing comes naturally to a lot of people.
Mm-hmm.
When we're young, we have a gift. The problem is I don't think that enough people enforce that this is a gift. You are naturally a very fast runner, for example, but now you need someone to get you the rest of the way to make this gift into a career. And I think that with singing, it's just always been thought that if you have that gift, you can just keep going, and you don't need to keep working at it. But I really say it is like any skill, that you will only get better at it and do it correctly if you continue to refine how you do it. The other complicating issue is that as we age, our voices change.
Exactly.
So how we use our voices has to change with us. The gift that you had at 6 can't be accessed the same way at 16. And so I think that mindset of accepting that even though I need help, that doesn't make me a bad singer. It doesn't mean I'm weak. It means that I'm going to hone my craft. I think it's a mindset shift that has to happen.
I'm going to delve into dangerous territory here, and I just want to add, the recording industry doesn't make it easy. It doesn't encourage coaches among singers. It really doesn't. And I believe that many times singers hear their favorite artist on the radio, and they know that they have advantages in recording technology. And so a lot of times I believe that many singers feel as long as they have a great record producer, the need for vocal coaching and maintaining their instrument for a longer career is not necessary. But what they fail to recognize is that going live on stage is when the rubber meets the road, and the truth actually then is revealed. In the recording studio, any great producer and engineer can do just about anything with any kind of voice. But once that voice hits the stage live, then the truth is really revealed. And that's a lot of times when singers realize, am I really doing this or am I just winging it? So in that regard, you're right. Many singers operate on talent and not on skill. They go to the vocal ATM and withdraw until one day they go to the vocal ATM and the ATM says
insufficient funds.
And then they come to your office or to my vocal studio.
It's very true, unfortunately.
You mentioned nodules and polyps, and I opened this discussion by mentioning a few noted singers like Sam Smith, Adele, John Mayer, who all recently admitted to having vocal cord surgery or some type of vocal cord injury. How are some of the problems like polyps and nodules treated? How would you treat that?
You know, I think one of the best things that happened with these prominent singers being vocal, no pun intended, about their injuries is that it's destigmatized them a little bit. Vocal surgery is no longer as fearful a thing as it used to be because we all heard Adele came back, she sounded wonderful, so we're not as scared of them. So we have to then say, as long as I'm getting appropriate treatment with an appropriate person, I will probably be fine. So the first thing in treatment is timeliness. It's getting to attention before it becomes a major problem. And I tell my singers, the longer the time before you seek care, the longer the time until I can get you better. The two are related. But the commonest vocal injuries, the muscular problems, nodules, those can go away non-surgically. They're therapeutic problems. They're learning how to use your voice correctly. They're getting care for medical issues that might be influencing the voice. So allergies are such a common problem here in Los Angeles. And if it's treated, right now, for example, I am really dying to clear my throat because my allergies are acting up. But it's little things like that. If I were to manage that better, I wouldn't have any throat issues related to my allergies. So treatment of voice disorders usually hinges on treating your general health. Polyps, unfortunately, are more commonly a surgical problem, but again, good hands, good training, a good relationship with your laryngologist means that you will come out of that surgery better. It's not as terrifying a prospect as it used to be even a decade ago.
You know, I often say to my singers, my artists that have sought me out for vocal coaching, that you kind of have to live this life as a singer. And that the singing actually does dictate how you live, how you speak,
Yep.
how loudly you speak, and how often, what kinds of foods and drinks you ingest. Your voice basically is leading your life if you are a professional singer. And I want to know from you, what advice would you give singers on preventing some common things that happen to singers, like hoarseness, and how do you deal with allergies and something even like acid reflux, which is common among singers?
Yeah.
You know, how would you advise singers on that?
I think the frustrating thing for singers is that your instrument, the thing from which you derive your livelihood and your life, is inside you. And so that means that anything that happens in your body is affecting your instrument and your livelihood. So the most important thing for me when I talk to my singers is maintain your body. Maintain your body in good health. The instrument will follow. So for allergies, rinse your nose. It is such simple advice. Rinse your nose. Do it every day. Follow the package instructions. You don't have to do anything fancy.
Is that what is it? The neti
Neti pot is
the
one
neti
version
pot?
of
Yeah.
it. Sinus rinse is the one that I think is ergonomically easier. It doesn't honestly really matter. Be diligent about it, because what you're breathing in, no matter where you live, it's not good air quality. I promise you.
Can we speak to the smokers and those who smoke funny cigarettes as well as...
We'll keep it simple.
Okay.
We will say anything you inhale will affect your voice.
There you have it.
Anything via any mechanism, any device, inhalation equals vocal cord inflammation. Easy?
Very easy.
Easy. Reflux. Reflux is a little bit of a hot button issue, because what I found when I came out here first and started my practice is that I got a lot of second opinions for voice problems. People who had been diagnosed with reflux, started the diet stuff, started the medication,
Right.
and didn't get better. And that was really frustrating for them, and so they were seeking a second opinion. And I think the commonest problem in vocal diagnostics is misdiagnosis. It's inadequate technology, inadequate training in the physician, people who want to treat singers because it's sexy to treat singers,
Yes.
but they don't actually have the ability to do it. And so they get this mislabeling of reflux, and singers kind of go on and on with what's probably a muscular problem for 2 years before they really get accurately diagnosed.
Dr. Gupta, one thing that I want to ask you is, how long do you think a professional singer should seek vocal coaching? I get asked that question a lot. Should I have a vocal coach for a month,
Yeah.
for a few weeks?
That is funny. I get asked that too, and I'm always really surprised by that question, because in my field, how long would you want me to continue seeking out knowledge in medicine, learning about new instruments, practicing my skill? Forever. As long as I'm interested in doing said task, I should be honing it. And the same thing for singers. As long as you're interested in singing and making an income from your voice and not being injured, you should be in training. To me, it's a no-brainer.
And again, let's go back to athletes. As long as athletes want to go to Wimbledon, the Super Bowl, the NBA, as long as their aspirations are greater than just your local tennis court or your local basketball court, then you need to be training with a coach. It is the difference between singing being a profession and singing being just a hobby. So singers, you have to ask yourself, if it's a hobby, that's one thing. But if it's a profession, that's something else entirely.
Absolutely. And I don't think anybody would be surprised to know that the top singers have vocal coaches. So how do we think they got there? They got to that high level because they were maintaining their instrument. Yes, it's an investment. Yes, it's money. But to me, it's money better spent than seeing me after the fact, right? So I would much rather you take the money that you've parceled out for your emergency vocal medical care and put it towards vocal hygiene and vocal technique, because then you don't need me for anything besides just want to check, everything okay, rock and roll.
And how important is our relationship, the vocal coach and the doctor of voice? How important is that camaraderie?
Go back to the team. Go back to the athlete analogy. The team doctor works with the trainer and with the athlete. And by the same token, I work with vocal coaches as that middle ground to the singer. So I will tell the singer what the problem is that I see. And then I'll tell the vocal coach what the problem is that I see. And then together, the three of us, often with my vocal therapist, so the 4 people, will collaborate to find the best way to get that person better. I can't fix most of what ails a singer. Exactly. Because most of what ails the singer is technique. It's usually overdoing it, misdoing it, those 2 things. And that's vocal coach territory. So you don't need me that much. Sorry, I'm putting myself out of work here, but that's just the truth. You need a vocal coach.
Yeah, exactly. And a lot of the problems that I experience with singers, a lot of times is exactly what you said. Technique, faulty muscular coordination, not understanding basic breathing techniques, and singers really not accepting the fact that coaching is what they need in order to become better at what they do and to maintain the God-given gift that they have.
Yeah, here's where I think the problem really lies, is that God-given talent. We exercise it in our teen years. The problem is that the period of time where you're starting to transition into success, you're making it a career for yourself, is just around the time where the vocal folds become more fragile. They become more injury prone in our early 20s. So that ability to bounce back, to push, to know that your voice will always be there, it starts to go away in our 20s, just as the trajectory of your career is taking off. So if you don't plug in right around that late teen, early 20s, that's when you start to run into trouble, because in addition to the cords becoming more fragile, you're also working much, much more hard. And so it ends up being that really kind of perfect storm. So that vocal coaching early on at that age, right where injury becomes more likely, is the best way to nip it in the bud. And to have your career.
Exactly. And I'd love to say that I have a great track record with my artists. They all sing well, but they all sing healthfully, and they all continue to improve vocally. The voices, tone, timbre, flexibility, range, all continue to increase with time and not decrease in time. And that's because I've been maintaining the voice live in the recording studio, wherever they are. Which leads me into my next question. Can you give some advice on what professional singers can do on their own to maintain the health of their instrument on a daily basis? Is there, like sleeping with a humidifier near your bed and things of that nature?
I tend to shy away from anything that distracts you from technique. Honestly, and I know that sounds like I'm just singing your song, and I am, because I really do believe it. Humidifiers, lozenges, teas, balms, and all that to me is icing, very thin icing on a substantial cake of good medical care, ensuring your medical problems are taken care of, and good technique. Nobody would expect the athlete to rely on Tiger Balm, right? You rely on working out in the gym, practicing on your off days, seeking medical care when you have a little bit of an injury or a little bit of a discomfort. It's not going to be the topical stuff or the things that you eat and drink, because nothing you eat or drink touches your cords anyway. So save your money on the tea, save your money on entertainers, whatever, and focus on the health of your instrument. And I think the reason a lot of us, or a lot of singers, have gone to those remedies is, again, misdiagnosis.
Exactly.
People are saying, I don't really know what's going on, so just keep working. And so then the singer is stuck. They don't actually have a good answer.
Myths.
Yeah. And so if you get good diagnosis, which is really hinged on getting a good laryngologist in your corner, getting video stroboscopy, no scope in the nose, no, wishy-washy exam, a really good exam and a good diagnosis, you're gonna get better. You don't need voodoo.
Exactly. There's so many myths out there plaguing singers, you need to drink this. You should not drink this. You need to sleep this many hours. You should not sleep this many hours. Tea and honey. And one of the things I'm glad you said is many times we drink things like tea and honey, not realizing it doesn't touch the vocal cords.
It doesn't.
Explain why.
So the vocal cords are the entryway to your lungs. Mm-hmm. So the body's design is to not let anything go in the lungs except for air. So by definition, that's the instrument we're trying to protect, is our breathing passageway. So when you swallow, everything closes up above the vocal cords, yes, so that food and drink go down the back. You don't want anything touching your cords. If anyone's ever had that experience of food going down the wrong pipe, that's something touching your vocal cords. That's not what you want. Exactly. So nothing you eat or drink is going to affect your voice. Now, some people say, and myself included, my throat feels better when I drink something steamy. No problem. Drink warm water, drink hot water, drink your tea with honey. But that's not a vocal solution. Exactly. That's something that makes you feel better. Exactly. If you sleep 10 hours and you feel better than when you sleep 3, respect your body.
It's a placebo effect.
Yeah, listen to it. I mean, do what feels good, mm-hmm, but don't rely on that to save your voice. Mm-hmm. That's not where it comes from.
And so many of you do. I see it backstage at so many concerts. You have tea and honey running out your nose, thinking that that's going to give you a better performance, all because you neglected basic vocal care. Mm-hmm. Basic vocal care. And now tea and honey is supposed to save you? I think not.
And you know not to. I think it's that last ditch effort. Mm-hmm. But that's where, I'm going to maybe beat a dead horse a little bit, but going back to the medical side, what I know more of, I always tell my singers, you can't be with me all the time. And exactly, you're going to be in different cities, you're going to be in different countries. If you remember a couple of key things, you're going to be fine. First off, you need a vocal coach in your corner. Secondly, do not neglect your medical problems. And finally, when, or if I should say, you do run into any problems, fellowship trained laryngologist, video stroboscopy. I know that's a mouthful, but that's how you make sure you get the right exam for your job, which is a voice.
Can I backtrack quickly? Because this is something that I find singers don't know. Vocal coaching is widely unregulated. There's really nothing to help a singer determine, am I seeing mm-hmm, the right coach? Mm-hmm. I know what I had to go through. Education, training, reading material, vocal pathology awareness and training, college, degrees and understanding of all this, and having a singing career myself. I know what I had to go through to do what I do. Tell me, from your positioning, what would you find that you would want a vocal coach to know?
I want a vocal coach to know who to access. Mm-hmm. So what is the right person to seek to help my singer? But most important of all of it is that you never stop learning, because that we are learning all the time. We're learning new things about the voice. So when a singer looks for a vocal coach, what I tell them is some of it is gut, some of it is just relationship, but some of it is continuing education, a relationship with a laryngologist, a relationship with a vocal therapist, a roster of uninjured singers, mm-hmm, and then credentials, of course. I mean, anybody can put up a signpost, myself included, saying that I'm a vocal coach. Mm-hmm. So looking at their background, and no, everyone with a degree doth not a good vocal coach make. Exactly. But that's where, you work with a couple until you find the right fit. Right. And access who they access. Ask, when you have a singer who's in trouble, who do you send to? And look up that person, because like attracts like. It's complex. It's not easy. The same way a lot of people can call themselves voice doctors and not be laryngologists. So yes, in the internet age, in this, current system, it's not easy, but using things like this, looking at a video blog that's made with passion about a topic that's relevant, that's going to help you. There's nothing else that you can really use except for the data that's presented to you. So just do your best to look at what that person is doing to develop their craft, and that's at least a step in the right direction.
And you're so passionate about this subject that you actually do a summer vocal masterclass every year. Is it in the summertime?
It's actually in March. It's in the
Okay.
I guess that's the spring.
It's in California.
You don't know here. It's true. But for that reason, exactly. I was looking around to say, okay, who needs this information? And it's not doctors, because doctors are not really trying to get that savvy about vocal care. So it's not going to also just be the singers, because there's only so much you can do as a singer to help yourself. The less fear there is around it, the better you can do to train it. The more you can become your own advocate, so that when another doctor tells you you have reflux, you know to question it, and you know to think, okay, there might be something more. Oh, they put a scope in my nose. I remember from that course that that's not appropriate. That's not how you diagnose the voice and voice disorders. So that course for me is my effort to empower the singing community with the knowledge they need to go out into that wide world of misinformation and misrepresentation to know how to navigate.
And the resources are there. So they're really for you singers. The information is there. The resources are there. Again, Dr. Gupta takes time out of her very busy schedule in March to host this vocal masterclass. I've been to it. She brings out some of the best vocal coaches, voice doctors, just singers around to just give you information. And that is something that is a resource for you. Are you in preparation for next year's?
We are. We are looking for March 2016. So vocalmasterclass.org. If I'm going to do a plug, it's going to be just keep posted
Plug
or
away.
jump
Plug
on
away.
Facebook and like it so that you can be updated about it. But it is, I think, the more a singer understands their instrument, the less likely they are to be injured.
And if a singer is experiencing any of the things that we've just talked about, hoarseness, allergies or anything of that nature, how do we get in touch with you?
My office, like you said, is at the Cedars-Sinai Medical Towers. So you can Google me by name. I'm sure you can provide them with the information. VoiceDoctorLA.com is a really easy URL. You feel free to reach out to us there. There's an email contact. There's a million ways to reach me. I try and make myself as accessible as possible. So I would love to take care of any singer. But to answer your question, one thing I think is really important is when to reach out, which for singers is 1 day. You get 1 day of symptoms before you seek care, because that's how fast I can flip you if there is a problem. And symptoms don't mean I've lost an octave. Symptoms are I'm fatigued, I have discomfort, I'm hoarse, it takes more effort to sing than it used to. That's get checked out, because I can fix that.
Exactly.
We can fix that together.
Exactly. And for me, when new singers come into my vocal studio, I'm able to hear immediately that they need Dr. Gupta's assistance. You may not be able to diagnose yourself that quickly, but as soon as I hear your voice on a vocal consultation, I immediately know this is a medical issue. It's gone beyond my expertise. Now I have to send you to someone like Dr. Gupta for assistance. And then once she's done her work, then come back to my vocal studio and I will put you in a position of technically teaching you how to train your voice so that you'll never have these problems again. You'll probably always have allergies, but all of the other faulty singing and, faulty muscular coordination you've been doing as far as not understanding how to maneuver your voice for high notes or low notes, belting and things of that nature that you've probably been doing to get power on the voice and things of that nature. Those are all things that need to be approached technically. Many singers don't understand that. Many singers just think of, I need to sing loud or I need to sing soft. And that's not the case. There is a process in increasing volume in the voice, or intensity as I like to say, and decreasing intensity. And that process has to be managed very delicately in order to maintain the health of the instrument. Dr. Gupta, thank you so much.
Thank you so much for having me. This was so fun.
Thank you so much. This blog is going to be seen by so many singers. You're going to help so many singers.
Oh, I hope so.
And I can't say enough of how valuable you are to singers, to the music industry, and what a treasure it is to have you, as a resource now to Sterling Voice Coaching, and to all the singers that you've assisted.
Thank you.
Singers, this is an important topic. You've heard straight from Dr. Gupta how important it is for you to maintain the health of your instrument. You cannot continue to sing on your talent. You need skill. Skill is engaging your mind in your activity of singing. Otherwise, you'll run into health issues that will labor you, compromise your career, compromise your God-given talent. Yes, vocal coaching is important for the duration of your career, not just seeing a coach once and then disappearing and not coming back again for several months later. That's not maintaining your instrument. That's actually not being professional as a singer. That's just singing as a hobby. You must understand that you only get one voice. You can't go to the Guitar Center and replace it every 6 months. You only have one instrument, and the health of that instrument is critical if you want to maintain this career for the long haul. Thank you, and sing on. Singers, I can be reached at SterlingVoiceCoaching.com. Find us on Twitter and or Facebook, and become a regular blogger at SterlingVoiceCoachingBlog.com. Call our toll-free number at 888-428-2328. I am here to serve you as a vocal coach and as a mentor and as your friend. Thank you once again for joining us for this very important video blog. I'm Ms. Lindia. Sing on.